Hi, I am Dr. Thomas Scotton's Avatar. These lectures have been created and reviewed by Dr. Scotton, but they are for educational and informational purposes only. This does not constitute and should not be construed as medical advice. All caregiving decisions should be made in close consultation with the individual's physician of record and qualified healthcare professionals. Welcome to Lesson 11, Fall Precautions and Home Environment Modifications. Today we focus on identifying and reducing fall hazards. Our purpose is to help family caregivers identify hazards throughout the home while addressing health, medication, and mobility factors. We will explain why falls are serious and preventable and how to complete a room-by-room home safety walkthrough. We'll cover pathways, flooring, stairs, bathrooms, and lighting, plus how to recognize personal fall risks requiring clinical support. Home modifications must fit the older adult's abilities, mobility device, vision, routines, and personal preferences. Grab bars, railings, and ramps should be securely installed by qualified professionals and may require landlord or local code approval. Falls are the leading cause of fatal and non-fatal injury among adults age 65 and older. One fall increases the chance of another. The encouraging news is that falls are not an inevitable part of aging. Many can be prevented by combining safer surroundings with health. Prevention includes stronger legs and balance, appropriate mobility devices, medication review, and vision and hearing care. It also requires good footwear and close attention to dizziness or illness that can affect a person's stability. Our goal is not to make the home feel like an institution, but to support safe independence. Include the older adult in each decision. Ask them directly, what makes you feel unsteady? Where do you reach for support? And what route do you use at night? Inspect the home at the times risk is highest. After dark, early morning, during bathroom urgency, and while carrying items. Walk the person's actual routes at their normal pace while they use their cane, walker, glasses, or hearing aids. Look from floor level to eye level. Ask, is the pathway clear? Is the surface stable and non-slip? Is there enough light? Is secure support available where balance is challenged? Can frequently used items be reached without climbing or bending deeply? Prioritize hazards that could cause an immediate fall. Loose rugs, cluttered stairs, wet floors, broken steps, and poor lighting. Make a written list. Assign an owner and a completion date. Recheck the home after any illness, hospitalization, or fall. Begin with the simplest high-impact changes. Remove throw rugs and small area rugs throughout the entire home. A rug that has never been a problem can become a hazard when gait, vision, footwear, or reaction time changes. Secure wall-to-wall carpet and repair curled edges or loose flooring. Use non-slip strips on slippery surfaces where appropriate. Clear walking paths of shoes, newspapers, pet toys, baskets, and decorative objects. These are common trip hazards. Route electrical and charging cords along walls, never across a path. Avoid running cords under rugs where they create bumps. If an extension cord is being used as permanent wiring, ask a qualified electrician about installing safer, permanent outlets. Arrange furniture so a walker can pass without turning sideways. Remove or reposition low coffee tables and unstable footstools. Chairs and sofas should be firm and high enough for the person to stand without pulling on nearby furniture for support. Avoid furniture on wheels unless it locks securely. Keep frequently used objects between waist and shoulder height for easy access. Never encourage the older adult to stand on a chair or table. Use a reacher for light items or ask for help. Clean spills immediately and block the wet area until dry. Do not use furniture or towel bars as weight-bearing support. Stairs require special attention. Install secure, graspable handrails on both sides for the full length of the stairs. Repair loose rails, uneven steps, and torn carpeting. Keep every step free of stored items, even objects waiting to be carried up. Provide bright, even lighting with switches at the top and bottom. Use high contrast tape or edge markings for visibility. Follow professional recommendations for markings so they do not create visual confusion. Encourage the person to always hold the rail. Keep one hand free. Carry smaller loads or use another method to move items. Clothing should not drag and shoes must fit securely. Never rush on stairs. A cane or walker must be used on stairs only as specifically taught by a physical therapist. At entrances, repair cracked pavement, loose bricks, uneven thresholds, and wobbly steps. Add railings or a properly designed ramp. Keep porches and walkways clear of leaves, hoses, tools, ice, and standing water. Turn on the porch light before returning after dark. Bathrooms combine hard surfaces, water, turning, reaching, and transfers. They require our highest priority for safety modifications. Install properly anchored grab bars near the toilet and inside and outside the tub or shower. Placement should match specific needs. A licensed installer, contractor, or occupational therapist can help determine safe placement and secure anchoring for grab bars. Use a non-slip surface in the tub and a secure bath mat outside. Consider a shower chair, transfer bench, or raised toilet seat. Only use equipment after confirming it fits both the person and the space. Remember to always lock any wheels before use. Keep soap, towels, and bathing supplies within easy reach so the person does not twist or stand on one leg. Dry floors immediately. Provide a night light or motion-activated light. Never lock the bathroom in a way that prevents emergency access to the person. Improve lighting throughout the home, not just brightness, but access and consistency. Put switches at room entrances and end of halls. Replace burned out bulbs promptly. Reduce glare from shiny floors and uncovered bulbs. Use contrasting switch plates when vision is limited. At night, illuminate the bed to bathroom route with motion-activated lights. Keep a flashlight and charge phone within reach of the bed. In the bedroom, keep the path around the bed clear. The bed should allow the person to sit with feet supported and stand safely. Keep eyeglasses, mobility aids, water, and phones in a consistent, reachable location. In the kitchen, store everyday items within easy reach. Sit for tasks that cause fatigue in the kitchen. In living areas, make sure remotes and phones are reachable without leaning. Manage pets thoughtfully. Bells and designated resting areas may help. Solutions must be safe for both the person and the animal. A hazard-free home cannot correct every fall risk. Tell the healthcare provider about any fall, near fall, or fear of falling. Ask for a medication review, including prescriptions, over-the-counter products, and supplements. Drowsiness or dizziness can increase risk significantly. Arrange regular vision care and update eyeglasses. Address hearing problems, foot pain, numbness, and choose well-fitting, non-slip shoes. Encourage strength and balance exercise, such as a clinician-approved program, physical therapy, Tai Chi, or community fall prevention classes. Fear of falling often causes inactivity, which leads to weakness and increases fall risk. Safe movement is a vital part of prevention. Encourage standing up slowly. Pause at the edge of the bed, then stand and steady before walking. Report dizziness or palpitations. Make sure canes and walkers are fitted and used as taught. Do not borrow or adjust equipment without professional guidance. If a fall occurs, stay calm. Do not immediately pull the person to their feet. Ask about pain, dizziness, and what happened. Look for bleeding, deformity, swelling, or confusion. Keep the person warm and comfortable without moving them unnecessarily until assessed. Call 911 for unconsciousness, severe bleeding, breathing difficulty, or signs of stroke. A head strike always deserves prompt medical guidance. If no apparent injury, follow the fall response plan. Use only a recovery method you have been trained to perform. Do not risk injury. Report every fall and near fall to the appropriate clinician. Record the time, location, activity, footwear, symptoms, hazards, and any injury. Review our check. Clear the path. Secure the surface. Add light. Provide real support. Address personal risk. Reassess after every change or fall. Let's finish with 5 quick questions to reinforce these concepts. We'll use our pause and decide 5-second rhythm for each one. Question 1. Are falls an unavoidable part of aging? No. Falls are common, but many are preventable by addressing multiple risk factors. Question 2. What should happen to throw rugs and cords? Remove throw rugs, route cords along walls, and keep all paths clear. Question 3. Where should secure support be installed? Properly anchored grab bars near toilets and tubs and secure handrails on both sides. Question 4. What is the most important nighttime lighting route? The route from the bed to the bathroom with a reachable light. Question 5. Should you pull an older adult up immediately after a fall? No. Assess for injury and call emergency help. A safer home does not limit independence, it protects it. Remember, remove rugs, secure cords, install bars, and improve lighting. A safer home is proactive. Thank you for completing Lesson 11 of the Family Caregiving Program. We are here to support you. Be sure to download your lesson workbook for the full safety checklist and additional resources. Stay safe, and we'll see you in the next lesson. This lesson was created for educational purposes. Always consult with medical professionals for individual care needs. Stay safe, and we'll see you in the next lesson.